Hi, I'm Dr. Jay Culkin at WIFH. Welcome to FaceTime Live, Facebook Live, I should say. Today, we're going to do a miraDry procedure. miraDry is a procedure that we do here every day for excessive underarm sweating. Some people have been diagnosed with hyperhidrosis. Many have been treated with underarm Botox for temporary relief. But we do miraDry here for permanent relief of sweating, getting results of anywhere from 60 to 95% reductions in sweating. We do it a little differently here, frankly, because over the years we've done over 8,000 liposuction procedures, and we use an anesthesia technique that is a little different than most. I've done most of the anesthesia here on Chris, who is our patient today, and we actually infuse a blanket of numbing fluid through a tiny opening up under the skin. And you can see that I've done this here on Chris earlier, just a few moments ago, so that we could get him comfortable to broadcast this. Now, in the room with us also, we have Charlotte. Charlotte is a nurse practitioner, and Charlotte has done over 200 miraDry procedures. Now today we're going to start this procedure now on Chris. We put a tattoo on Chris here. It's a tattoo that's obviously not permanent, and it has a grid. And Charlotte will be placing the device very strategically. I do see just a little drop of blood on there, and that's simply because I removed a tiny skin tag earlier. So, Charlotte, let's go ahead and get started so people can see how miraDry is done. So we're putting the device on. Charlotte's going to press a button, and we're delivering microwave energy to the underarm. You can see Chris is obviously not feeling anything, I would assume.
All good?
Good. All right, and that's typical. I mean, it would be extraordinarily rare for anyone here to feel anything during this procedure. There's about 15 seconds left at this location where Charlotte has the device, and then the machine will indicate to her when it's time to move to the next location. And we will go all the way down through the grid at each location. So that was the first location, and now we're going to do the second. And we continue on. Again, it takes about 40 minutes, roughly 30 to 40 minutes on each underarm. And then Chris will be able to drive himself home. How we doing? Feeling okay? Yeah, nothing. He'll be icing this evening, using ibuprofen for pain, although a few people have asked us for something a bit stronger like Tylenol with codeine. He should be able to work from home this evening, and he should be able to certainly have his normal work activity tomorrow and back in the gym in a few days. We've seen no complications from miraDry in our 200 procedures. These patients have done extremely well, reducing odor as well as sweat. And it's been interesting that some people who are even 90% reduced have wanted sometimes a second procedure 3 months later. But as a rule, one will work for about 80% of our patients. Now, some of you might have questions today while we're doing this, and if you do, please send them on and we'll be happy to answer them. Katie, who's filming, will let me know if there are any questions. But this is miraDry, and we find it to be the best procedure for excessive underarm sweating. It helps people be able to wear different colors instead of just wearing black all day or dealing with odor from their excessive sweating. Katie, do we have any questions that have come across?
Not so far.
Not yet. Okay. Well, good. Well, Chris, how you feeling?
Good.
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 Yeah, this is really, this is what we'll do now here for the next hour and 10, hour and 20 minutes. And hopefully we'll see a very extensive reduction in Chris's sweating. So thank you for joining us today at WIFH in Atlanta, Georgia. And if you have any questions, of course, just contact us. We hope you have a great day. Thanks for joining us. Bye-bye.